adults. Now, most of the children you have seen limping, others have lost arms because they don't know what to do.
Of a qualified pediatric nurse. A qualified pediatric nurse is expected to be, in the first case, all the qualities of a pediatric nurse are supposed to be acquired by this nurse in order to help him or her carry out the role of a pediatric nurse. Should be loving in the first case, love for children, be empathetic, and he or she is an advocate of children. So a qualified pediatric nurse is expected to provide care that is in wellness and illness. In wellness, we are expected to give health education to the caregivers of children.
My name is Mrs. Margaret Maruswa, a retired senior principal nursing officer. I trained as a state registered nurse, as general nursing, and I did midwifery. Then I went to do pediatrics. But before that, the government of Uganda used to import nurses from Great Ormond Street, pediatric nurses, to come and work in children's ward in Black Hospital. So that's where I got the leave from there. So I trained in England, and pediatrics came as a last course after going through general nursing and midwifery. Pediatric nursing is so rewarding. When you have this child sick, comes with a high temperature, very sick, but after getting treatment, you see them smiling and tagging you, whereas an old person will remain poorly. Oh, I'm still sick, I'm this and that, but for a child, give you reward immediately. As soon as they recover, they are so happy with you, and you can, make friends with them.
Was going around the files, I could find some doctors writing underdosing for the child or overdosing for the child, and I could do what? Call that doctor, says, oh, this and that, please. So a pediatric nursing officer or a nurse, he knows exactly what is going on in the pediatric ward. So my request is the government should have pediatric nurses and be recognized, because when I trained as a pediatric nurse, I remained on the salary level. What? Yet other courses, when you upgrade, they increase what? Your income.
I'm a pediatric nurse, but for me I trained in 2008, and from 2008 up to now I've never been promoted as a pediatric nurse. So in other words, pediatric nurses are not being promoted. That's one.
Some hospitals, regional referral hospitals, you find that they stop at 4 years, and from 5 years they are taken to where? To adult wards. And really this child cannot fit in the conversation of big people. And when we come to the management, the treatment of these children, the doses, they differ from the doses of adults. Now, most of the children you have seen limping, others have lost arms because they don't know what to do. And especially in clinics, they come when the arm is gone. Some have lost their arms. Some are limping because a child who is below 5 years is not supposed to be injected in the palm, because the muscle which is there on the bottom is thin. So when they inject it goes in the nerve, and then they will say polio, when it is not polio being caused by the injection they are giving. Number two, in the schools, the nurses, you find we have what we call conversion disorder in these children. So what they do, they start giving treatment when they don't need treatment. Those are the challenges. When they are given drugs, they come to the hospital with complications. Then in the hospital, you find someone is posted in pediatric ward. but she will tell you that she's not interested in children. Why is that they are training pediatric nurses and they are denying the rights of children? We have gynecologists, they work with midwives. We have psychiatrists, they work with psychiatric nurses. We have physicians, they work with general nurses. And the good thing, we have pediatricians, they are working with who?
Most regional for hospital, we need a pediatric nurse to be in MCH, a pediatric nurse to be in a theater, a pediatric nurse to be in at least 2 pediatric nurses to be in the pediatric ward. But when you look at the number, it is too small to be distributed to even the regional referral hospitals. And yet now, even the health centers down, they are also suffering with nobody.
To be a member. And every well-wisher, whether he's an adult, a retired person, civil servant, as long as they have passion for child care, they can also subscribe to be pediatric nurses. So subscription is a payment of 50,000 to be a member, a full member. And then we have annual subscription of 50,000.
Boards which are there, let them have the minimum number. If they are training, they have talked of the challenges of the training school. They should train more. But those ones on the ground can be utilized and go and serve the nation, serve these children who are innocent. Then what I had forgotten, even I request that the country or the government should consider sickle cell children. The way they brought the free testing of COVID, HIV, these parents, they find it so hard. It is a lot of money. For each test is 40,000.
To refer children, we find in community that is in wellness in case we cannot do it. And for those who are sick, we are expected to provide care as in regards assessment, medication or treatment, and rehabilitation of children in case they have had disabilities following the illness or sickness. We are also expected in the community to prevent home accidents, which are a dilemma in most of the homes. Sometimes caregivers, parents do not know how to prevent these accidents, and they cause grave disabilities to children. For example, many of them don't know how to protect children from fires or from burns, poisoning, which we are supposed to teach them onto how to avoid them and reduce the disabilities or morbidities that come as a result of home accidents. Pediatric nurse is a researcher. She's expected to research on the new what comes on vogue as regards the management of children, because the world is dynamic. The new changes that come up as regards medication of children, treatment of conditions that come with children, and we are international. Whatever is locally in the government can occur outside Uganda, and we are called upon by God to love and serve in all the whole world in the globe. So we are expected to know anything that happens outside the country, internationally. So pediatric nurses, as qualified, they are expected to be leaders, and we also have, as an association, a policy in association that pediatric nurses and the new curriculum under revision, that pediatric nurses are meant to head pediatric units. Rest in a unit, a ward that is headed by anyone else other than a pediatric nurse may not be successful because of the specialization that nurses do in pediatrics. They are able to guide the colleagues or subordinates upon the management of children and how to go about the conditions that children suffer from. Pediatric nurses have a lot of roles other than what they acquired from the basic training. They are expected to be social workers. So even beyond what we do in the clinic, we go to the community and link up the parents who have abandoned their own children, especially some fathers abandon abandon the mothers for the children, and this is a stressor to the children. So we also do school health. We expected to go to schools and visit schools, get to know children's problems.
At Health Center 4, we ideally need these pediatric nurses, but we are getting ourselves with the midwives handling the work of pediatric nurses. Like for example, when I'm in labor suit, I should have a pediatric nurse to receive this baby as I attend to the mother. But because there is no pediatric nurse, the midwife is doing the work to the baby, to the mother. But even in theater, the midwives are the ones receiving babies, and yet we get babies who need resuscitation. Other babies need oxygen. Other babies have feeding problems. But all this is being done by the midwife because we don't have any pediatric nurse at Center 4, and yet we need them. Yet we have pediatric wards. They are being handled by general nurses who may be lacking certain skills to handle these babies.
We are supposed to be in maternity to look at those newborn babies who are having some problems. We are having neonates. We are supposed to be having
So the challenge of the tutors, we are still very few. I don't think we can exceed 5. And yet, when you look at hospitals, each hospital, most especially far hospitals, they have pediatric units. So we need more tutors. Secondly, there is only one school in Uganda that trains pediatric nursing. That is Ginger. School of Pediatric Nursing. With a review, of course, we have just currently reviewed the curriculum. With a review of the curriculum at implementation level, we will encourage the government to open up more pediatric schools, especially at least the regional.
Those who are licensed are over 300. I don't have the actual number, but there are over 300 pediatric nurses in Uganda, trained and licensed.
Okay. Is that number enough?
We train as trainers, we train, but the numbers we train are supposed to be controlled by Ministry of Health. So a gap, I believe, is there because as per structure, they expected to come from the lowest level facility to fill the gap, because when you look at the number of children, they outnumber the number of adults. So the children are vulnerable, and they need, at least every health facility needs 1 or 2 pediatric nurses.
The students who are pursuing this diploma in pediatrics are government-sponsored students. It is the government that is sponsor. We go through application after the advert is made. Then after you are successful, you are posted to the school. In Uganda, we only have Ginger School of Pediatrics. It is only one school which is training, and I think that is the reason why we are only having little number in the country.
So, pertaining the donation we have given in Alufenya Hospital, it came us from our heart, not someone who came that let us buy these gifts and we give to mothers, adolescents, and the young babies. So it is not like that. It us, the pediatric nurses, who came up. We sat down, then we see how are we going to help our mothers and the children in the hospital, mostly in Nichu, adolescents who are in the hospital. So we came up, we collected, we contributed money, we bought those items.
Bali mukwato gato.
Having all the skills. When they give me malnutrition award, they started dying every now and then.
I don't know whether they have made it.